What should be the Philippines' game plan to prevent the spread of the more contagious variant? To get insights, we have infectious disease specialist and epidemiologist Dr. Eric Tayag. Dr. Tayag, welcome to the big story.
Thank you, Ravi, and good evening.
Sir, so on the one hand, we have imposed a travel ban on Indonesia and countries where we know Delta variant is starting to spread. On the other hand, we are also going into lower restrictions within the country. How do these two things balance out, you think?
Okay, Ravi, good evening again. We are beyond rehearsal for protecting everyone against the original strain or the variant strains. What we must understand is that there has always been a comprehensive approach. Now, the risk related to the spread of these variants may gain us some time so that we're able to protect ourselves. First, social mixing and social mobility, if left unchecked, will actually spread the virus. Second, if we relax on the public health measures as well as on the social restrictions that we have imposed in different areas of the countries with this community quarantine, this lockdown, then we will again lose. And lastly, we should have enough supplies of vaccines. The uneven distribution in other countries, in many countries in the world, have allowed the variant to spread. And the unvaccinated population have been shown to be factories of these variants. And so, therefore, it's very clear that we will impose a comprehensive approach. Make sure you have clean hands. When you wear your mask, you cover your nose and mouth. If you have symptoms, you have to get tested. This is both Rovi for the vaccinated and unvaccinated. We cannot rest our laurels. Those who have been vaccinated are too confident. You should still wear your mask, clean hands, and if you are indoors, open the windows. There should be good ventilation. There's no reason for you to relax anything, Ravi.
In the meantime, Dr. Tayag, you mentioned obviously one of the most important things there, vaccination and supply of vaccines. Where are we now, and how would you assess where we are in our timeline for our targets for achieving, if not herd immunity, at the very least population protection?
We have received over 20 million, that's 21 million doses of the vaccines. We have administered over 14 million vaccines, but we are not close to 10% having been fully vaccinated. And many areas do not have the necessary supplies of the vaccines. And so, therefore, we should have a strategy for areas wherein there is increasing number of people who have been vaccinated. Make sure you get the 2 full doses, except for Johnson, of course, which we don't have yet. But for those areas which have not started or has just started vaccinating, the comprehensive approach still works. Mask, face shield, wash your hands, stay away from conglomerations of people, any mass gathering, and please follow the local government guidance in your areas. This is not the right time to debate, to argue, because all the interventions, recommendations have been based on science. And this is a dynamic situation, and we are learning more about these variants, Robbie.
Maraming salamat po, Dr. Tayag, infectious disease specialist and epidemiologist Dr. Eric Tayag.